Hello, everybody. Now, unless you are a troll who happens to be living under a bridge waiting for three goats to go by, chances are you have heard of this story of the suspect who offed a United Healthcare CEO in New York. Now, what I find very fascinating about this whole situation is just the way mainstream media is covering it versus the sentiments of your average everyday American. And I think the best way to actually describe this situation is was from a joke by Chris Rock. And something along the lines, he once said, I'm not saying he should have done what he did, but I understand. But let's actually start off with this video, and we'll comment after that.
News for the gunman who shot the CEO of United Healthcare. These are new images of the suspect in that black jacket and mask. Detectives say he dropped his phone in the alley as he was running away from the crime scene. They also have a bottle of water that he purchased at Starbucks minutes before the attack. They hope they'll get fingerprints or DNA from that. Fox's Connor Hansen has more on what's being called a brazen targeted attack and possible motive.
Shocking murder happening right here on this sidewalk behind me in the heart of Midtown Manhattan. Police are now searching for a suspect in what they're calling a targeted killing. An all-out manhunt Wednesday in New York City for the suspect who gunned down the CEO of United Healthcare. Brian Thompson was shot and killed outside a hotel where he was set to speak to investors.
I want to be clear. At this time, every indication is that this was a premeditated, pre-planned, targeted attack.
Police say a masked gunman shot Thompson in the back before fleeing on foot and then riding an electric bike to nearby Central Park. The 50-year-old executive was rushed to a nearby hospital but did not survive. The NYPD says it doesn't have a clear motive for the shooting.
It appears the suspect was lying in wait for several minutes. And as the victim was walking to the conference hotel, the suspect approached from behind and fired several rounds.
Police say the gun jammed before the suspect cleared it and started firing again.
At the scene, we recover 3 live 9mm rounds and 3 discharged 9mm shell casings.
We have the drones up, we have aviation out, we have K9 out.
Thompson did not have a security detail with him, and his wife told NBC News he previously received threats but did not alter his travel plans. In New York, Connor Hansen, Fox News.
Yeah, and towards the end there, I just find it fascinating how that, I'm assuming who's an investigator, she literally kind of goes like, yeah, there's like no clear motive, and literally in the shell casing there's like delay, deny, and defend engraved into the shells. I think this man had a motive for what he allegedly did, right? And what's actually what I can't stop thinking about too is just, I'm actually surprised that situations like this haven't occurred, before. I mean, literally, we have a healthcare system where it's profitable to deny people coverage. I mean, that's literally how you save your shareholders money. I mean, we have a for-profit industry for people getting sick and denying them health coverage. I mean, I can only imagine what kind of situation this person gets to this point to where he's just like, okay, I'm in a situation where I can't win, and he decides to make this kind of decision for himself. It's really kind of bringing to light, and I really wish like these types of discussions happen a lot more openly, like about our broken healthcare system, because it is broken. It shouldn't take a situation to where a person gets to the point, it's like, okay, fine, the CEO, the decisions that this man is making is having a downstream effect on my family, or whom I'm just assuming, right? Maybe it's either himself, his mother, his child. There's just so many different individuals who could be affected by this, and let alone the amount of Americans who get denied yearly, over like 20 million. It's a ridiculous amount of Americans. So literally there's like 20 million suspects who it could be. I saw someone's post the other day who mentioned that, like, this is just a situation that it needs it's a broken system. We need solutions and we need them fast. People are getting more desperate. And if people are getting much more sicker at a much alarming rate. People are starting to get more autoimmune diseases year over year. I mean, just all of these things are, increasing year over year. People are getting less coverage, but they're getting sicker every year. People are dying a lot sooner, even though we have all of these modern medicine and techniques that no one can afford. What's good of having all of these resources when no one can use these resources? And so I just find this situation incredibly fascinating. And I almost feel as if I'm under kind of two fronts. I feel he's this particular person of interest will end up getting captured, and but in the event that he doesn't, that would be even more fascinating, to tell you the truth. But I'm going to get really interested in following this story because I think it's just going to have so many twists and turns into it, and it's literally going to be something that has to be talked a lot further, and not from a mainstream media angle, from like a person to person kind of your favorite, whether they be influencers, whether it be the left or right. I mean, there's just so much to be said here where it doesn't matter where you fall on a political perspective. We've all had situations, or at least here in the States, where we have an extreme privatized system where, you have been denied coverage because you left off a comma, or it's just all these ridiculous reasons. The health insurance industry will find a reason to deny your coverage even though you've been paying into it. A lot of times, the printer, the paper that it's printed out on isn't even worth, the paper that you wipe your butt with. Like, that's literally how bad your coverage could be, and you don't even know it. Like, if you get sick, you could go bankrupt like the next day. If you happen to get a bad luck of the draw, I mean, that's just it. That's the way our healthcare system works. So I'm really fascinated. I'm wondering kind of what everyone else thinks. Tell me what you think. Like and subscribe.